How to read and interpret x-rays. So we're looking at x-rays to really see what do you see in the x-ray. Even if you're not looking for something in particular, like let's say you didn't take the x-ray because the patient says they're in pain or they're having a sore tooth on the upper left-hand side, you're just taking the x-rays because it's been 5 years. Or for a new patient exam, we need them to get an overall picture. What are you looking at? So you're looking at radiolucent and radiopaque areas. Radiopaque areas are white areas, more dense, whereas radiolucent are darker, and it's where the x-ray beam passes through freely. Think the periodontal ligament, the nerve of the tooth. It's not a hard structure, so the x-ray beam can just pass through easily. Typically, the most common things we're looking for are things like infection, a periodontal abscess. Are we looking for cavities? Are we looking for a tooth that's erupting or a tooth that shouldn't be there because they have an extra tooth? Just anything that doesn't look quite right. So radiopaque areas, like I said before, think of your tooth enamel. That's going to be more white. When you see things that are gray or black, it means it's not as strong, it's not as hard, so the x-ray beam passes through quickly. Cavities are going to be radiolucent, so they're going to be black. We would not expect to see a black area where that tooth is, because that tooth there, the enamel, the crown, should be white, should be radiopaque. So if we see a radiolucent area in there, that tells us it's a sign of a cavity, or it could be a cavity. And something to keep in mind is if you see a cavity in the x-ray, it's worse than it actually is. A very tiny cavity likely won't even show up in an x-ray per se. Sometimes it does, but then sometimes it doesn't. Or it might look a certain way in the mouth, but then you want to check how it looks in the x-ray. Or you see something in an x-ray, you look inside the mouth and you don't see it, or it looks different. So you always want to compare the two, inside the mouth and then look at the x-ray. Look at the x-ray and then back inside the mouth. Another thing we like to look at are the bone levels. Bone loss, for bone loss to show up in an x-ray and look like the bone is shrinking, it has to be more advanced than what it seems to be. Early bone loss does not show up in an x-ray, but moderate bone loss does. So if you start to see the bone thinning or shrinking in an x-ray, that's not good. Their bone loss is not good. Bone loss never is, but if you see it in an x-ray, it's more far gone than you might think. And so cavities and bone loss, these are kind of the main things we look for. Now, cavities we typically look for in a bite wing, and periodontal disease as well, so bone loss. Think bite wing. A periapical, though, is also really good to see cavities and bone loss as well. It's just kind of a zoomed in picture of 1 or 2 or 3 teeth. But periapicals are more specific to see the whole tooth. So the crown, the root, the apices, the bone support. So see how you can see cavities, bone, the apices, all in a periapical. It's amazing. A bite wing is the top teeth and the bottom teeth together. So again, also good to see cavities, bone loss, and anything else. A panoramic film is the exterior, so it takes the x-ray on the outside, it goes around the head, but you see everything, the whole top arch, the whole bottom arch. You see the sinuses, you see the condyles back here, the TMJ area. It's a good overall picture. I personally love taking and seeing panoramic x-rays because there's no hiding. You can see if teeth are starting to erupt. You can see the full picture, and the patient doesn't mind it because we don't have to put anything inside the mouth. So just think about it like that. When we're looking at x-rays and when we are going to interpret them, depending on if you're a dental assistant, a dental hygienist, or a dentist is best to diagnose these things. But a dental assistant and a dental hygienist can absolutely say, I suspect a cavity. There's a dark spot here. Something here isn't right. So it's good to be trained and know what you're looking at, but a dentist is trained even more so to know exactly what's happening. And different x-rays are going to show different things. So let me know if there's any questions. Thank you for watching, and I'll see you in the next one.